founder of Rethink Yoga. There are a couple of stretches that I think are really important to take before you step on your mat, especially if your practice is going to be a power vinyasa practice. Taking a couple of stretches before class does not mean you're weak. It doesn't mean you have a disability. I am 53 years old, and after a lifetime of yoga, I have some imbalances in my pelvis. I have a hypermobile pelvis, so I can put my foot behind my head no problem, but sometimes my pelvis is so mobile it will shift out of alignment. And if I'm about to take a class and my pelvis is out of alignment, I'm going to run the risk of doing damage in my hips because of the way my femur bone will come up into my pelvis. So, those of you who know me know I was born with a birth defect, missing 4 vertebrae. That could have been a factor. For other people, they get this hypermobility as they go through and their hormones change in midlife into their 50s and 60s. I see it come from all different places. There's a way to work with it, not really a problem, but give yourself a chance to re-level your pelvis before you start class. Especially if you've been noticing that you have some hip pain, because that's a good sign that that's what's happening. Here's the pose I will always do before class. It's called Z pose. You take, I'm taking my right leg in this case, grab the top of your foot, take your foot behind you on the floor. So you have an internal rotation of this thigh bone. You have an external rotation of your opposite thigh bone, and my left foot, my sole, is up against my thigh. For some people, their pelvis is very out of alignment, and so the hip, one hip is going to come up, and this will feel painful. No sweat. Take a blanket, use it to prop up your hip. This should make it feel more comfortable. So you don't want any pain in your knee or in your hips. Take your hands to the front of your knees. Begin to rock over your sit bones and your pelvis. So I'm drawing my heart forward, and then I'm pulling my belly back. And I'm rocking my pubic bowl forward and back. And what this is doing is it's allowing my femur bones, my thigh bones, to get back into the socket of my hip, and my pelvis resettles into a balanced position. So now, after I do this, and I'll do this maybe 5 or 6 times, I can start to feel that my pelvis is rocking easier. Now I'm going to take my hand to my femur bone. My other hand comes outside my hip. I'm going to rotate that femur bone in the socket and then rotate it back. And I'm really grabbing the bone. Rotate it and then rotate it back. And I'm going to do this 5, maybe 6 times. Once I've completed one side, of course, you want to move to the other side. The interesting thing is, because the pelvis usually comes out of whack right-left or front-back, one side's going to be a whole lot easier than the other side. You'll feel it like right away. Oh, that was it. Here, I have no problem, no stiffness, no soreness, and I can roll with a lot more ease. But don't skip the other side just because it's more comfortable. Do both, make sure you're even. Once you go through the rolling, moving the femur bone in the socket, you're ready for your first down dog. Namaste.